Well, BC's decriminalization pilot will end at the end of this month, January 31st. And Health Minister Josie Osborne made that official announcement on Wednesday. Osborne says she hopes that police take a health-first approach in their interactions with drug users moving forward. But exactly what will that mean when drug possession is once again a criminal offense? Well, Deputy Chief Alison Laurin is with the Vancouver Police Department, and she's been good enough to join us now. Good morning to you, Deputy.
Good morning, Stephen. Thanks for having me.
Thanks so much for being with us. Former VPD Chief Adam Palmer was one of the early proponents of decriminalization. He thought it was something that was worth a try. 3 years later, how welcome is the end of this pilot at the VPD?
Well, Stephen, when decriminalization was proposed in the face of a health crisis of tremendous proportions, we were willing to try something new, but it quickly became evident that it just wasn't working. So we will be pivoting. We're pleased to have clarity on what will be coming on February 1st. And, we are still searching for the health-led solutions to this terrible crisis.
And when you say you're still searching for those, where are you looking?
Well, certainly we're continuing to hope for evidence-based solutions. The gaps for this are going to come, we believe, from mental health interdictions, health-led initiatives to address what is truly a health crisis. The police will continue to do their role on enforcement for those most serious manifestations where drug possession is leading to undue harm to our communities.
Right. The health minister says that the pilot didn't deliver the results that they wanted, obviously, but the province submitted quarterly reports to Health Canada throughout this pilot. And those reports show that visits to supervised consumption sites increased province-wide during the pilot. The reports also show that drug possession offenses dropped significantly in the first year of the pilot. Do you take away anything from those results?
Certainly during the whole pilot, police have been encouraging the use of supervised consumption sites, so that is not surprising, and we will continue to do so moving forward. But when we look at the number of offenses, police did not have the authority during much of this pilot to address some of those offenses. So we need to be careful with those stats about seizures and interdiction by police because we were directed to have certain behaviors be exempt.
Okay. The BC Association of Chiefs of Police put out a statement this week, and in that statement, their president, Deputy Chief Andrew Chan, said this: unintended consequences emerged during the pilot, including a noticeable increase in public drug use, street disorder, and related impacts on community safety. So in what way did decriminalization lead to more public disorder and more danger to communities?
Certainly. It removes some of the tools that police have to use their discretion in interacting with individuals with substance use disorders. So those tools have now been restored to police in full with the removal of the last few exemptions. Supervised consumption sites, overdose prevention sites operate under separate exemptions, and those will continue to be areas where police will direct people with substance use disorder to safely consume illicit substances.
Former Chief Coroner Lisa Lapointe spoke yesterday with our program BC Today and Michelle Elliott, and here's what she said about the connection between this pilot and that public disorder.
Interestingly, though, the exemption was varied quite significantly in May 2024. And in fact, drug use in public went back to the former criminalization model. So public drug use has not been lawful in the province for almost 2 years now. So any street disorder that people are seeing or believing that they're seeing in the last year and a half, 20 months, even if it was related to substance use earlier than that, but certainly in the last almost 2 years, it has been illegal to use drugs in public. So this won't make any change to that.
And do you, Deputy, what do you make of that comment? Do you think that the ending this pilot program now is making much of a difference, considering what the former Chief Coroner just told us?
Sorry, Stephen.
It's okay.
Most recently, the exemption that was removed was set to include private residences and people who are unhoused and certain healthcare facilities. So there are additional changes coming. With respect to street disorder, it has certainly become more prevalent during the decriminalization project. And what we're looking for is the right balance
Right.
between safety for our communities, accessibility to businesses, while respecting the dignity of people with substance use drug disorder and directing them to appropriate health care. So despite the end of the pilot, several things have changed. We are not returning to criminalization, in my opinion. The CDSA, Controlled Drugs and Substances Act, was revised in 2022 to clearly direct that a health-led approach should be a strong guideline for both police and for health prosecutors. So that continues to now be part of the Controlled Drugs and Substances Act. So to me, that's a fundamental change, and we are not reverting to the way things were.
Well, right. And this, I mean, if you go back to 2020, there were new guidelines issued by the Director of Prosecution Services back then that said the guidelines direct prosecutors to focus on the most serious cases raising public safety concerns for prosecution and to otherwise pursue suitable alternative measures and diversion from the criminal justice system for simple possession cases. And I guess it's also been VPD's policy since about 2006 that officers consider an individual's behavior and the risks to the public when they decide on whether to recommend a criminal charge.
Absolutely, Stephen, and we do follow those guidelines. Police will continue to focus on the most serious manifestations when we are looking at simple possession charges. And we do continue to charge for the other criminal activities that are often accompanied or sometimes accompanied by drug-fueled behavior. And so we are looking at those cases where there are organized criminals trafficking drugs, where there are any use of drugs that put children and youth at risk, things like drug possession in association with motor vehicles or driving that put the public at risk. So we continue to focus on those serious manifestations as directed by the courts, while commonly referring the people that we interact with on a daily basis to those services that are available.
It seems, Deputy, every time we have this conversation on the radio, we get a raft of people who come in and say, why aren't you focusing more on the drug dealers? Why aren't you focusing on the traffickers? How much emphasis is there on the drug dealers or the traffickers?
Absolutely. That is the primary focus of our officers. Those organized criminals that are trafficking in unregulated drug supply that is toxic and killing thousands of British Columbians are our primary focus, and we will continue to do our best to remove those drug supplies, those toxic drugs from the streets.
I want to ask because we know that the Victoria Police Department has said they're going to reintroduce street patrols to address crime in that city. We do already see a very visible police presence in the downtown east side. But is that proactive or reactive, though, for the most part?
Well, certainly we see that as proactive policing, having our officers out on foot, available to the community and present to interdict what we need to. That said, we cannot police our way out of this crisis. The solutions for this toxic drug crisis are going to rest, we need to fill the gaps with mental health, prevention, addictions, treatments, and those are beyond the scope of policing.
Deputy, thank you so much for your time this morning. Appreciate it.
Thank you. My pleasure.
Take care. That is Deputy Chief Alison Laurin with the Vancouver Police Department.